Everyone, this is Tomer Yanni from PLAYWORKS, who has this great demo for us today on today's Tech Huddle. Tomer?
Okay, thank you, Dustin. First, I want to thank Dustin and Disability Cocoon for this opportunity. This is really good opportunity for PLAYWORK to show and to demo our product, which, as Dustin said, is really something that is also suitable for these times. I will explain further later on the presentation, and thanks, Dustin, for the opportunity. Okay, my name is Tomer, and I'm from PLAYWORK, and PLAYWORK is a company that develops technological physical therapy equipment. The idea of the company is to transform common physiotherapy equipment into smart and digital rehabilitation products. And what I'm going to demo to you today is I took the concept of a common device like physio balls. You know, this is not a regular ball. It looks regular, it feels regular, but it's not regular. This is a ball. It is called PlayBall. It's a smart device that enables patients to play interactive game while performing a variety of rehabilitative ball exercises. There's a ball, there is a smart brain, we call it. It's a smart sensor that measures movement and measures the pressure, the force applied on the ball. And it's connected by Bluetooth to a tablet and the screen and our software application. It's virtually a control panel that comes built in together with the device, which is also can be also connected to any other screen like TV, computer screen, or everything you like. The screen enables the interaction, the control of the games during the exercise. So this is the general idea. Before I will show you the app or the software that is connected to the ball, I will say that the ball was chosen as a common device because it serves almost any kind of rehabilitative procedures. It's suitable also for various orthopedic disorders, for upper limb, hands, lower limb, balance, you name it, and also for cognitive disorders like after stroke and CP and many other disorders, to enhance, to improve the compliance, the engagement of the patient, to make it more fun and engaging. And on the go, it also monitors and takes note, logging the performance and the progress of the patient during the whole rehabilitation process. So this is the general idea of the device. I showed you the play ball. It's it's a quality ball. It's made of Italian brand called Ledra Goma, and the smart device is mounted in a very simple industrial process that we manufacture currently in Italy. PLAYWORK is a company, virtually a technology startup company that is providing the technology, and the Italian company manufactures the ball. So this is about the product. About the software, the idea of such a device is to be very, very easy to use, very simple, very seamless to use in any rehabilitation establishment. It could be a hospital, it could be a clinic, it can be at schools and in different kind of environments, and also at home, because it's so intuitive and simple. It's portable. You can take it anywhere you want. You can even, I say something for nursing homes. Sometimes they want to do it in the garden. So they go out to the garden and they do their rehabilitation exercise. Why is it? Why are we talking about the advantages currently in this time of social distancing? You know that mainly, you know, disabled people and also elderly people, which are in higher risk. They are mostly, most of them are now and are going to be for a long time isolated, and still they need to undergo their physical rehabilitation and exercises. This device has a big advantage, being able to be used without a clinician, without a therapist supervising all the time. It's very simple and basic to use and can be used, and the advantages also without a clinician at home or in a facility. So this is why there's a big advantage for this product at this time, at the COVID-19 outbreak, and later on, because everything is going to be different in regards to how people are going to be treated and how the connection will be between the therapist and the patient. So let's jump in. It's a very simple app that is the login. You know, the first screen after you push the PLAYWORK button is the login screen. Here you can do both, or you log with your personal ID number, or you just enter as a guest. The advantage of logging with the ID number is that all the information, all the outcomes are saved under your own ID number. So after you log in, you have a select games. We have 6 different games. They are based on, as I said before, on 2 movement mechanics. One is the movement of the ball, and one is the pressure applied on the ball, the force you press on it. And I'll start with a few mechanics and a few games to show you how it works. Let's try this play force game. It's actually, you can see a small spaceship that while I'm pressing on the ball, it's shrinking and getting closer, getting smaller, excuse me. When I start the game, you will see the ship navigating in space tunnels, and when they become narrow, then you have to press on the ball to shrink the spaceship in order to pass through all these space tunnels. The idea is here, for example, when I'm entering a small tunnel, if I'm not pressing, it gets stuck and I get not disqualified, I get minus points. And I have to press all the while when it's inside and release. So it's like an interval of pressing and resting. 2 seconds, 2 seconds pressing, 2 seconds release. This kind of exercise can be done for virtually any organ. You know, I can do it simultaneously with 2 hands. I can do it only with 1 hand. I can do it for shoulder with pressing on the wall, like this. I can do it between my thighs. I'm not sure that you see it correctly now, but maybe you do. If I'm pressing between my thighs, I also shrink and expand it when I release. So as a clinician, or any clinician can think of any other way that he can use it, and according to what the patient needs to practice. Another thing I want to show you is that anything here is personalized, because every patient or every individual has different abilities. So if I'm in the beginning of my rehabilitation and I only can press small amount, so I configure it to a smaller force and save it for my for my exact ability. This is called a personalized game. So this is also a nice feature. Of course, we have also a feature that we call performance test. It's a individual performance test. The patient needs to press a few seconds on his maximum force that he can do, and the system now takes this number and keeps it for until the next time, and also configures the game according to the test that I perform. So this is what we call a personalized game for rehabilitation. So we can do it for the amount of force that needs to be applied. We can configure the length, how long will be the exercise or the game, and we can control also the intervals of work and rest, press and release. This is changing the length of the tunnels according to the time that I wanted to practice with the patient. So if the patient needs a longer time resting, so he takes the release time and expand it between 1 second and 10 seconds, and the same is for the pressing. So this is about the first game I showed you. The second game is called Play Move. Play Move is a game that combines between movement and pressure together. Okay. When I start this game, you will see that actually what I have to do is to control a small ball. You can see that I'm moving my hand in all direction, and I'm controlling the location of the ball. When I start the game, my mission is to collect monsters. You see, I have to collect monsters and to be precise as I can on the circle. You know, this training also the movement, and also how precise is the movement is. These are the parameters that I'm also measuring at the end of the game. Okay, how many monsters I collected, this is the point, but also how long did I stay exactly on the circle to measure the precise movement I conduct. Okay, this is the basic game. From time to time you can see that obstacles are coming around and I need to go away. It is a smart game in regarding to how fast it goes. Meaning, when I'm a patient that's working very very slowly, so the game goes slowly. But when I'm going faster, you will see that also the monsters are rising, are showing faster. So this is adapting to the ability of the cognitive ability of the patient. Okay, I hope I'm clear. Maybe if you have questions later on, you can take a note and ask me these questions. This was the basic movement. However, as I said, we combined also the pressure feature to this game. And here I can add also the pressure feature. The idea here is that if I'm now playing without pressing, nothing happens, as you see. Nothing happens because I have to press. When I start pressing, you can see the ball virtually changing and becoming brighter. Now I can collect the monsters. Only now, when I have to keep on pressing all the time, if I'm not doing it, so it goes back and I'm not able to collect. So the idea here is when I'm getting stronger, getting better in my condition, so I can also combine the pressure together with a movement feature. Okay. This is virtually this is the second game that I wanted to show. This game is suitable also for various kind of of exercises. You can do it while sitting on a table. You can do it on a wall. This is a very known to any clinician ball on a wall exercise. It is good for shoulder and all hand over. And we practice this game sometimes with balance when the patient is standing and putting one leg on the ball and just moving it with one leg and practicing his balance. He can do it, of course, with both legs. This is another idea. What nice is in general with this kind of device that clinicians can invite their own exercises, and every week we are surprised with new clips and videos that are sent to us by clinicians that invite themselves new games. Of course, we share all this information in our website and in our YouTube channel, and every customer of ours that is working with us is going in to get notification about new exercises and new ways to use the ball and new practices for all kinds of disorders. Okay, this I showed you two games. We have more games. This is a game that is based on, it's like a kind of fruit ninja. If you, some of you know this game, it's not exactly, but it's the same concept. You know, I have here a knife that I'm shooting at a kind of tree, you know, a kind of tree, and I also need to shoot it on exact time when I hit the apples. After I complete the number of knives that I have here on the left, all the screen explodes and it goes to the next level. From level to level, it becomes more difficult, meaning I get more knives, so I have less space to redirect and to put them inside between them. If I hit a knife, I get disqualified and I need to begin again the game from the start, like here I showed you. So I need to do it. So from each screen, it gets more difficult, and this is something that kids and grown-ups and people in nursing homes, they do it for hours. You know, there are hundreds of screens, and you just play the game and you don't feel that you practice your organs. If it's a hand, if it's between the legs, if it's under the leg, you just do it, you work, it's fun, it's engaging, and you can do it longer and get all the benefits with it. So this is another game, you know, even now I'm playing and I'm challenged. I'm challenged and I want to complete and I want to succeed and I want to make more. And it gets, from time to time, it gets more and more difficult. So let's fail or just pause and go to another game. There are some more games. This is a game that the idea here is to keep the small spaceship flying and not falling down to the ocean by pressing timely presses on the ball and trying to collect stars and avoid asteroids that are coming against the spaceship. I need to press and keep it up, and also, as you see, to take this, to take the stars, the yellow stars, and I get the score every time I'm able to catch one star. So let's see, here is an asteroid. I need to avoid the asteroid by keeping higher or lower, depending on which location it came. And this is the way I'm playing the game. If I'm falling down the ocean, so I have to restart the game. The last one I'm going to show is a shooting gun. It's like in the circus that you have to shoot cans and you have to shoot on bottles. So this is also a pressing mechanism, but here you also learn to do it on the right timing. So it's involved with hand and eye coordination. This is a very important exercise for some disorders to practice your hand and eye coordination. So this would be about the games. I will also show you the dashboard screen. We have a dashboard. As I told you before, we are always monitoring the progress and the performance of the patient. So if you press on the dashboard sign on the upper right side of the screen, you come to this dashboard screen. Here you can see all the recent exercises. And what we see here is the date, the name of the game, how long did I play, and what was the result. For example, when I'm playing a game that is operated by pressure, then I measure the maximum force applied on the ball, okay? And if I'm practicing a movement game, let's see if I have here. Here, I have play move. I played now on the 28th of April for 1 minute, and my precision in percentage was 63, meaning 63% of the time of the minute, I was precise on the circle. All the other time, I was probably out of the circle. This information is logged to a graph, so you can see the maximum force for each day you have worked, okay? And we expect, of course, during the time, the graph to be, to go upper, to go higher, and to show improvement. If it's not so, the clinician has to see what's wrong. So this is the maximum force. Same for the precision, and another gamification elements like high score and high score for the complete clinic, and active minutes longest per day, all kinds of features that you can see your personal ability and personal performance. Here we have a real-time feature which gives you a feedback, visual feedback on the pressure applied without a game. If you just want to practice some specific, you know, let's say hand grip, like I'm doing here, I can practice myself. Let's say I need to stay for 10 kilograms for 10 seconds. I can measure here the time, and this is a specific practice that you can do for a specific malfunction if you want to strengthen something in particular. This would be it. I think we've gone through. Last thing I will show you, we have also the sign-in screen here. You can see in which user you signed in. You have information about the battery of the ball. The sensors have a battery. It is loaded every day for a couple of minutes. You can up to half an hour loading time, and it's full to 100%. And it provides you a long time to work with it. So this is another feature. That would be it. Actually, we sell now in the United States. I think Ed, that is responsible, Ed is owner of Action Tech company. They are selling the product in the United States. If there's any questions about sales, about more information in the United States, I can give you the contact information of Action Tech. You can contact us also. We can provide our website, and I'd be happy to answer any questions if you have.
That was that was an amazing demo. Thank you very much. Perfect. We do actually have a few questions that have come in. Can you save the data from each body part for a particular user? So can I compare the data from right hand to left hand, right leg, left leg, seated, standing, that kind of thing?
Yes, that's a great question. This is a feature that is going to be released on next versions, meaning that before you start the game, you decide on which organ you are working.
Okay.
And once you do this decision, then the system already knows for you to show you the difference between the two organs that you practice.
Great. And looks like somebody did just put in the Action Technologies contact information with a website, phone number, and email address. So that's where you can go get it in the United States. I also put a link in the chat earlier directly to PLAYWORK's site. So the other question was, it looks like somebody has been on your site while you were presenting, and it looks like the ball is purchased with the control panel. Do you have plans to allow for the purchase of the ball and a download of the app in the future, or do they always come together?
Yes, the reason that it comes built in is because this is many of our customers tell us, bring us a whole package. Why bring us a whole package? Because they know, they have experience that with devices that you need to download, they have problem with various devices. You know, one has an iPad and one has an Android, and in Android you have the Amazon device and you have the Samsung device, and each of them has some different features, and customers they claim, they require from us to bring it as a bundle. This is the reason why we do it. It's easier to operate, it works better, it doesn't make too much burden on the price. It's a good device, and this is our recommendation. This is how we sell today.
That makes sense. And what about how often do you need to charge the battery? And then a very COVID-related question, great question. Any special cleaning products to disinfect the ball?
Okay, so I'll start with the second one.
Okay.
As I said, this is a common ball. A common ball like in every clinic. So you can do with it, you can clean it, you can use any protocol that you're using today. If you're coming from a clinic or if you're a clinician, you probably know. If you're not, if you're a private, if you're a private consumer, we will of course instruct you. Can use almost any. It's a quality. It's a quality product. You can use almost any cleaning device, but we can give any recommendation and to advise you on how to do it. Actually, in the next few weeks, we are going to upload a disinfection clip, how to do it, on our website. So you will see the process. We will do it in a clip, in a video, and you can see it on your own through our website.
And then the first part is,
Okay.
What's the anticipated battery life?
Yes, we designed the device to be to work for for a working day in a clinic, which means up to 8 hours and 5 hours of working time. Okay, this is the specification. However, I can tell you that the ball is charging very, very, very fast. So if you have a problem during the day or you did not charge it completely before the start of the day, you can put it for 10, 15 minutes and it's fully charged to work with it again. That's
great. And I'm assuming that this is now being used in home environments. How does a therapist or a clinician manage the game settings, therapies that they would like the person to do remotely? Is that possible? Can the therapist log into that individual's account and manage which games and things that the person should be doing?
Mainly at this time, mainly the clinician. If you're working with a clinician and you have a therapist, and he's doing it with you for the first time, and then from visit to visit, you can make a different configuration. Okay.
Okay.
When the clinician is visiting or coming, or you're meeting with him in any way, so you can change. But it's very simple to change the configuration by yourself, and the clinician can advise you how to do it also on your own when you're not deciding. And in the clinic, it's easier, because in the clinic or in a nursing home, let's say, nursing home is a combined home and clinic environment because it's home environment, but there are therapists in the nursing home, let's say. So you have to advise with your therapist in order to make the change in the configurations.
Okay. Okay. Well, any other questions for Tomer? Actually, I've been ignoring the Q&A part.
And I will say one more thing, that some clinicians use it as a additional device during telerehabilitation session that is currently expanding in this situation. It helps them to engage the patient during the telerehabilitation session. And what you asked before can be done also when you use this device during telerehabilitation session.
This is great. One last question that kind of back to the battery thing, not how long will the battery last on a charge, but how often does the battery or ball need to be replaced? Can you replace the battery and sensors out of the ball, or do you just replace the whole ball?
This is a long-lasting battery. We provide a 1-year guarantee, okay, for the whole device. If there is a problem, a technical problem, let's say, after 1 year, we provide also an option to purchase, another year and up to 3 more years in total. Okay, so this is what we provide now as guarantee. I can tell you that we have it working, and we almost face no issues with it. It's very robust. The chargeable battery, it's very common today. Every smartphone, cellular phone comes with a chargeable battery, so it's not need to be replaced. And in the limitation that we provide this 1-year guarantee and the option to lengthen the guarantee for additional 3 years in total.
Last question, and this is a me question. It's the competitive side in me coming out, I think. Do you ever envision having a multiplayer game where you have people competing against each other?
Sure. When you go into the digital world, so there are unlimited features that are going to be or are possible to develop to such a device. Competitive is one of them. Of course, one of the features that we're planning to do in the future is to make it that you can use 2 balls and 2 users simultaneous or more, maybe, and many other features. You will get notifications to your smartphone, and you will get a social network and everything. And this is endless opportunities, and these will come during the time. I just mentioned that if anyone purchases the device now, we are providing at this time a free, in most of the bundles that we sell, the upgrade of the software, meaning new games, new features, is coming for free to anyone who purchases now the system. So this is important to mention because it's it's very nice, very good opportunity now.
Wonderful. Great. Well, Tomer, thank you very much for jumping on and doing this demo today. This was a very engaging demo, really hands-on. We've had lots of great comments, great product, great demo in the chat. So well done. Really appreciate you taking the time to show us this. For those of you that want to share this with other people, it will be archived at disabilitycocoon.com. So you can go there and find it. And really appreciate everybody jumping on today. Hope everyone's well. We do have a tech huddle next week, so just check the website and you can see what's coming up. Tomer, thank you again.
Thank you. Thank you, guys.
Thank you all. Have a great day, everyone, and stay safe.